Welcome everyone back to the Yosan University 39 Gen podcast. I have two amazing guests with me today. Now, would you like to introduce yourselves, tell people who you are, and a little bit about what you do? And who wants to go first? We have two guests.
I'll go first. My name's Coleen Smith, and I am a practitioner in Spokane, Washington. And this year, I'm the president of the American Board of Traditional Chinese Medicine and Reproductive Medicine, so the ABORM board. And I have been on the board since 2010 as a board member, and been more active the last few years as the board has been evolving and making changes. And it's been exciting. It's been a great time to be on the board because we have been able to advance acupuncture fertility medicine a lot through meetings and groups. And yeah, it's my passion. Education is kind of part of my passion. Um, I I love learning. I love research. I love treating my patients and doing the magic that we do in Chinese medicine. So that's my claim to fame. I was a nurse for a long time. I started as a nurse many years ago, became an acupuncturist in 2004, and then have kind of rode the fertility wave since then.
That's awesome. Well, thank you. And who are you?
I'm Whitney Fessler. I practice in Jackson Hole, Wyoming, and I am the current executive director of ABORM. And I echo everything Colleen said. It's my passion. I love the education that we offer. I love bringing that into the office and essentially giving people a roadmap of what to expect and, supplying them with the knowledge that they need to take home a healthy baby.
That's awesome. Well, let me ask you this, because this is awesome, and you've got my mind going. But can you tell our listeners, what ABORM is and why it matters in the field of reproductive Chinese medicine?
Go, Whitney.
Sure, I'll take that one. So we all learn fertility treatments in school, a little bit, and that's great. But in today's world, we have a lot of assisted reproductive technology. So IVF, IUI, medications, natural planning. There's so much to it. So where ABORM steps in is we require this extensive background knowledge of Western fertility medicine along with Eastern fertility medicine so that we can marry the two and essentially be the liaison for our patients between what we do from a more traditional, natural, if you will, approach, as well as helping them with the Western world. So, getting to know their cycles, their hormone levels, what their partners have to do with it, helping that aspect. And it makes it more efficient for them because they can go to their doctors and say, hey, I need this test, or I would be interested in these tests. And I think that I'm interested in also doing, XYZ to conceive. So ABORM gives everybody who's a fellow who passes the exam, gives them a level up, an edge, if you will, to help out their patients. And it also lets a lot of fertility clinics and OB-GYNs and other reproductive physicians knowledge that we have the same knowledge as them, or enough knowledge to help people out. And it helps them out too, because they don't have to have, this long discussion of education. And so it just tells them that we are slightly more qualified, or a lot more qualified, really.
I'll give you an example, Sean.
Love it.
I had a patient that came to see me, and she'd been seeing an acupuncturist in the area, who told them that they could handle fertility. She was in her 20s, and she came in with her whole line of symptoms, and for reproductive medicine problems, bleeding. And as I went through her history with her, she told me what her treatment. She'd been doing moxa, she'd been doing different herbs. She'd went and saw a naturopath to combine with the acupuncturist. And she came in and told me, I have this diagnosis of endometriosis and they haven't been able to help me. Could
Mm.
you help me? And by the time that I finished her history, I asked her, she didn't have medical insurance, and I stopped and said, you know what? I really feel that we need to pull an OB-GYN in on this conversation because what I'm hearing, I don't believe you have endometriosis. And she said, I said she'd never had a laparoscopic procedure. It was just an assumption based on some of the abnormal bleeding that she'd had. And so I got up from her appointment, called an OB-GYN that I know, and had her arrange an appointment to see her within a few days. And that woman went to the doctor. That doctor referred her to another doctor. She ended up having cervical cancer. She
Oh,
came back
wow.
2 years later and thanked me and said, "You saved my life that day." And I was like, "Yeah, that's exactly why you see a specialist in the field."
That's amazing. And it kind of answers my question. It's like, it sounds like what you're doing is raising the standards of care and fertility acupuncture. It's raising the standards of what a practitioner can do and what is expected of people in this field. And how does being, ABORM certified help people better collaborate with Western physicians and other healthcare professionals? How does this training help with that?
Well, that's a great question because I think when I started with ABORM way back when, maybe in 2008, I thought it would open doors for me and doctors would be knocking my door down and saying, "Oh, good, you have this specialty. Come see me." But that was not the case. But what it did for me was when I went into their office and knocked on the door and had it on my card and explained to them because it did require some explanation. Hey, I'm certified as a fertility specialist in the acupuncture field. What does that mean? And it would open the door for a conversation with them. And nowadays, we've been an active part of the American Society of Reproductive Medicine since probably 2014. We have a special interest group there. So
Okay.
that has also opened doors for us and opened doors for ABORM because there's a link between ASRM's CAMS, SINSIG group and ABORM. Most of the practitioners that belong to the SINSIG are also ABORM specialists. So the doctors at ASRM look for us as a practitioner, and this is one of the reasons we wanted to be on your podcast and other podcasts is getting the word out there to physicians that hey, we're here and we're here to help you get better birth rates and better clinical pregnancy rates and we can speak your language and we understand what you're saying when they say, oh, this is a frozen transfer. Oh, we're starting stems. What drugs? We understand what drugs they're using, and it really does help with the conversation between the physician.
It opens up doors for them as well because there are plenty of times that they have patients that they're not responding to meds or they're having failed transfers. And so when they know about us, which happens a lot and more every day, they say, go see an ABORM practitioner and see if, they can help at all or in conjunction with what we're doing. Because some of these people, it's just, fertility is never textbook. It is never straightforward.
Yeah.
It's so incredibly difficult. And so a lot of times when we're working together, it's just, it's the right combination. So for them, it's amazing. And I've said this a million times. So apologies to people who have heard me say this, but one of my favorite things that a doctor told me was, I don't have any idea what it is that you do or how it works, but you understand what we do. And that's so important to us.
That's huge. It's like you don't. There was I live in overseas. I live in Asia. I live in Vietnam. And so one of the things when you are speaking, coming back to what you had said, Colleen, about the communication, sometimes we're not even speaking the same language as people. And when you're not speaking the same language, it's a hard it's hard to communicate, and there's a lack of it. Like you said, I don't know what you're doing, but things are working, and there's something powerful to that. But if you can have things work and have a common language, a shared language, it's a big deal because you see this. I was watching this one game, a football game, and there were all of these different players playing on this one team. It was like a big international team. Sorry, soccer, international football. And they, all these guys were on this team in Europe, and they were speaking different languages. And though they played together, they had a new player came in who didn't speak the same language. And there was this disconnect that happened. And so when you can get people on the same page, speaking the same language, then it's much easier to accomplish the same shared goals that you have.
And in Chinese medicine, we tend to forget that we are speaking a different language when we're
Yeah.
talking to doctors because we start talking about qi and movement and blood and stagnation, and they look at us like, "What are you talking about?" You know, because they're like, "There's no stagnation. We're stimming them right now." And
Yeah.
yeah, they don't understand that kind of I don't want to use the word gibberish, but you know what I mean? Like they just don't get it.
Yeah.
And my reproductive endocrinologist, I work with two small clinics here. Um, but one of them, he's like Whitney has said, I don't know why it works. I don't care. Here, go see these patients if when they're unsuccessful. But the other clinic, they're a bigger center in Seattle, and then this is their satellite clinic here in Spokane. And they like people to have acupuncture just because they've seen a lot of the newer research that shows higher birth rates, higher clinical pregnancy rates. So then they will actually tell people, yeah, you should do acupuncture if, but they still do the caveat if you're interested. Not,
Yeah.
they don't actually tell them, you should try this because you're going to do better. When the patient says, I think I should try this, they go, oh, yeah, you should try that. But it's not kind of like the other way. They'll say, what else can I do? What else can I do? And then they'll do it kind of lastly. So
Yeah.
um, it's frustrating.
And even
For sure.
that's changing. I've just noticed in the past 6 months. And so because I live in a very rural, remote place, people have to travel to Denver, Salt Lake, or wherever to do IVF. So what they're being told in general is, 8 treatments or 16 treatments, as much as you can, leading up to transfer, leading up to egg retrieval, leading up to whatever they're doing. And, when that comes from a reproductive endocrinologist, that means a lot, and they do it, and it helps. It's great.
Oh, yeah.
So
Yeah.
it's more and more, they're seeing what we can do and how we can work together, and it's just great. I really, really
That's
love where
awesome.
this is headed.
How do you approach working alongside physicians, OB-GYNs, and reproductive endocrinologists in your integrative care? How do you work with these people?
Do you want me to answer that first,
Sure,
Whit, or you want
sure,
to go?
go for it.
Okay. Well, what I do is I'm in communication with a lot of physicians and doctors. I was a nurse first, so I kind of understand that mindset of they're super busy. You just have to writing a letter of reference after they send me a patient. If I get referrals, I respond back with thank you for this referral. So I try to be in pretty open communication with physicians so
Nice.
that they see my name and they hear it. And so I send them notes through their patient. So if I have a patient comes in and sees me and says, I'm seeing this doctor down the way and he did this and this and this, and I go, can you send him a message and ask him if we can get a progesterone on day 21, and just say that, you can tell them that I asked, and or could we get a HSG started if that's something that they, like we'll ask for different tests and say, hey, would you, I'm not shy about asking for maybe what we need and just, but always bowing to their expertise. You know what I mean? Like saying, okay, I was thinking this might be a good idea. What do you think? Like, do you think this is a good idea? Because then they can make that decision and go, oh, yeah, we could add that. And then they'll sometimes even pile on and give us more, But um, so I'm that person that's writing letters to them. I have a couple standard, but we try to add um, a personal touch. I've gotten to know so many physicians in my area because I've been here for over 20 years that I even have like the reproductive endocrinologists have their cell phone numbers so I can actually text them if we're run into a problem with somebody. So that's just years of practice,
Yeah.
but yeah, and the other part that I don't want to forget is I speak a lot of research to them. I'll
Yeah.
send over articles. So, like an article just came out. Well, it was in 2023 about like the tens, or we call it the T's. The electrical stimulation on acupuncture points, a
Hmm.
T's unit, and so they did a meta-analysis in 2023 on that. And so I make sure that they all have that. So they know that I'm helping patients put these electric stimulations on at home, and it helps their patients with improving live birth rates. And that study is particularly great because it also talks about CoQ10 and DHEA. So I'm all about supplementation. And so then I go, see, look, what we're doing is helping your patients, look. And so then they're like, fine, like they see that at least every year I send them a little study. Last year I sent them all a study on juice, the watermelon and beetroot juice that it improved after a frozen transfer. So yeah, I do things like that.
My situation is so different because it's such a small town. But we went from 5 OB-GYNs to 2. And for a couple of reasons, the political climate where we are makes it pretty difficult to practice how they need to practice sometimes. Cost of living, a lot of reasons. So we are down to 2. And they are, I think we have one more that's here, but just starting. Anyway, so they're OB-GYNs. So they see everything. They deliver babies. They're getting people in for monitoring for IVF. They are doing IUIs. They are seeing people for their annual exams. They do everything. So we communicate a lot. And I think it's if someone comes in to see me and they're just starting to figure out, try to get some help for pregnancy or conceiving, if I can say, listen, make an appointment with these guys around day 3, get these tests right away. Here are some other things that you might want to think about down the road, depending on how things go for you. But if you have this, and she can walk into the OB-GYN's office and say, this is what I need. This is what I want to look at. Let's get it done. It's so much easier than I'm trying to get pregnant and it's not working. Where do we begin? For
Yeah.
these 2 doctors who are completely overwhelmed, that they have that, they can kind of run with it. And so for me, it's really a lot about helping them do what they do best. And
Yeah.
that's by giving these women and these couples, again, a roadmap. And this is what you can expect. And maybe just schedule all of these things out in the next 6 months in case you don't conceive. But also, they refer a lot of people who, weird abdominal pain, cycle issues, irregular periods, heavy periods, and they don't want to do birth control. They don't want to do the regular kind of standard protocols. So they'll send them to me, say, go see Whitney, see what she can do. And it's great. So that's, reproductive medicine, but not about having babies, about having healthy cycles and healthy bodies.
I love that. Well, this is interesting because it is what you've described to me are just relationships and networking and relationship building. And it's so, at the end of the day, these successful relationships are built on communication, they're built on connecting. But for newer practitioners looking to build these relationships, how do you recommend they start?
Well, when I was new, I just started by going to the offices. I went myself, introduced myself to the front desk staff, and said, "Hey, my name's Coleen, and I'm an acupuncturist." And they go, "Oh, well, we know a couple acupuncturists." They immediately tried to get rid of you. And
Oh,
so
really?
sometimes sometimes bringing cookies helps. Food always make enters the door. You say, "Here's a little bit of snack," and put your card in there. Ask to do a lunch and learn. I always asked to do lunch and learns, and then came back and did a little education if I was allowed. I did that all the time. I literally had one day a week that all I did was go and visit doctors' offices and or um the specialist. The the reproductive endocrinologist in my town hardly spoke to me for 9 years.
Wow.
Like, I went all like, and I didn't go weekly to his office, but when monthly, I was there because they'd have a patient who wanted me to come and they'd allow me in to come and do the needles. And I would go there and he would avoid me. He would just go on. And I just smile and wave and just kept building relationships in his office with all of his staff
That's
because
amazing.
those nurses and that front staff, they're the gatekeepers of that office. And
Yeah,
so they all fell in love with me and they helped me get patients in their practice. They'd say, "Go see Colleen." And the patients are listening to them. And so that's how I did it. And I didn't know one person when I moved to Spokane.
that's absolutely amazing. Now, um, what about you, Whitney? Do you have any advice on that one?
Yes, one is patience, patience, more patience, and both kinds, the kind that comes in to see you and the kind that you have to have for yourself and the process. Uh, but honestly, all the things that Colleen said, and then also it is gonna, promote ABORM a little bit here, but when you become an ABORM practitioner with all of the CEUs required and the education and constant emails of practitioners all over the world sharing information, it makes you stronger, it makes you better. And so when you can share that with your patients and then they go to the doctor, whether it's OB-GYN or reproductive endocrinologist or whatever, and they have this knowledge, then over time it picks up and they say, "Oh, yeah, I've seen other patients that see her. And
Yes,
it seems like um, she knows what she's talking about." And that is truly for me as an ABORM fellow as well, is that's how it's helped me in my practice. Um, it's not anything more than that. It's just I'm learning and I'm getting the knowledge more and more every day about this and sharing with my patients, they share with their doctor. So it's sort of this for me, it's sort of the patient's the middleman and they kind of do the footwork, really.
that's awesome. Well, let me ask you this. You coming back to ABORM, ABORM is emphasizing, evidence-based and integrative care. How do you incorporate the latest fertility research into your treatments when working with patients?
Well, we just went to the Yosan Symposium, and that's a great, and two thumbs up for
Mm.
Yosan.
Right?
And so they had some great information there. I actually learned many things there, and it was nice to go back and tell my patients, "Hey, I've been doing this, and I just saw a bunch of research on the tease unit that this it was a little more specific with what they taught, like, and the research." And so I pulled out a bunch of that research that was presented, read it, and then started teaching my patients, "Okay, this is what we should be doing. Let's do this slightly differently than what we were doing it." And yeah, I'm that person that's constantly looking for that. And what's Whitney said, ABORM, it we put it on the Google groups. We talk about it in our newsletter. We have a newsletter that we put out, and every time we have a newsletter, we talk a little bit about some new research that's out there. We try to highlight that, and then members pull up if they see something on the research that's kind of new, they'll pull it out and put it on the Google group, and people try to even get the whole article so you can read the whole article. It's a great resource for us as practitioners. For me, it's been invaluable because when I get stuck or something that I've never seen, we have Paul's, the reproductive endocrinologist, Paul Magarelli is on there.
Hmm.
And so we can ask a question and get an informed answer if it's something we don't understand.
What research or innovation in the field are you really excited about right now? Is there anything that's coming down the pipeline that's really interesting to you?
I'm getting excited about more attention to male fertility and the role that males play in this huge world of fertility. It seems pretty obvious, but
Right.
unfortunately, I feel like there just hasn't been a lot done in the past. It's always been sort of a woman's problem. So I think more and more is going to be happening. Well, it is happening already. So I'm anxious to see how that goes. And also, I think with more research, more male partners will be more interested and more inclined to seek different treatments instead of just the female partner. So I'm anxious to see where that goes.
That's awesome. Now, what can patients expect when they come to see an ABORM certified fertility acupuncturist?
Uh,
Well,
Go ahead, Whitney.
going back to my classic roadmap is we start at the bare bones, and what is your cycle like, all of these things, and then considering from the eastern perspective and then also the western perspective. So as I said earlier, immediately, when was your last appointment with your
Yeah.
OB-GYN? Okay, let's get that scheduled, because if there's a structural abnormality, then we
Hmm.
don't need to waste our time. I mean, they can still come in, we can still work on things, but let's say they're missing fallopian tubes. There's no sense in running around and wasting time. IVF is it. So let's
Yeah.
rule those things out. Let's check hormones. Let's do all of this. And from our side, we will also be treating things, your blood, your shen, you know,
Yeah.
chi, all of our things from acupuncture world. Um, so they can expect a little bit of a roadmap from both sides. This is what, maybe it will take 3 months, maybe it takes a month, maybe your cycle is completely insane. So we have to address that first, and then we can see what happens. It's it's just a big roadmap of see these people, see me, and together we can make a good plan for you.
Can I interject? I love that analogy because I often on my podcast will reference mariners of old, people crossing the ocean, and they had like just this vast ocean that you had to cross, and they had a map that, and they had the compass and a sextant to kind of help them see where they were at, and they had to then chart the course. And the thing is like if someone gave me a map, I remember in like Boy Scouts, someone handed me a map. I couldn't read that to save my life. I was like, I don't know where I'm at. And they're like, it's like having someone who can help you, first of all, take a map, look at the map, read the map, and then figure out how to get from where you're at to where you want to be is a huge deal. It's like, it's a powerful thing to be able to give someone a roadmap. Say you want to be a successful businessman person, or you want to be a doctor, or whatever it might be. If you have a roadmap, it's easier to achieve that. So, I mean, a roadmap for fertility I'm here is us having a healthy baby in our house. How do we go through that? It's such a great analogy.
I love that too, because as we talk to our patients, so many patients come in and they say, well, I'm following this practitioner and I'm talking to this nutritionist. And I mean, by the time I see them, they have like 3 or 4 people in their corner. Oh, I did this detox. And perfect example, I had a new patient this week who told me that for the last 2 years, she's been infertile for 5 and she's 29, and she said, I've can't change my cycle. I've seen an acupuncturist for 2 years. I've done nutrition therapy. I've done functional medicine. And she just went through all the things. And she's like, none of this has changed. So
Mm,
don't start me with this plan that you're going to put me on this and it's going to make all the difference, because I've done everything. She thought she's done everything. So what I started was, okay, let's like a roadmap. Let's start at the beginning and let's talk through everything. And I went through a plan with her and I said, let's just talk about everything that I know that you need to do to be successful at this. She's going through a frozen transfer. And we just sat down and I laid out an entire plan for her. And she just was blown away. She said, this is amazing. Like, and then I've seen her almost, of course, because she's doing a transfer in 2 weeks. We're going to be seeing a lot of each other before her transfer.
it's amazing.
But yes, it's kind of cool to be able to put all the pieces together for somebody. And these lay people, they think they're doing everything, but they're kind of like pulling one piece here and one piece here and not always getting it together, and especially not in the right order. And all these things matter. So it's kind of
Yeah,
cool. The roadmap. I love it.
I love that. I also like the I'm gonna date myself here, but you remember watching the original Karate Kid? And I don't bear with me on this analogy. So the original Karate Kid, Ralph Macchio, was wanting to learn martial arts, and he pulled out these 2 books and he was looking at these books, and Mr. Miyagi walked in. He's like, learning karate, huh, from a book. And he's like, you can't learn that way, because it's, you pull a little bit from here, you pull a little bit from here, and you're getting all this half information, and there's not the synthesis of information that is required, that
Correct.
you need a guide. You need a true guide to help you synthesize all of these different things. Because I mean, it's like we've all been there, where you're feeling a little unwell, you go online, you search your symptoms, and you're like, oh my goodness. Oh my goodness, some condition, not what you have, but it makes you terrified. And or like, what is the treatment? I remember we were in clinic and some person came in and they were like, needing this, I need this treatment. They're like, you don't need that treatment. That's for like people that have this. Like, oh, I've got that. Are you sure? Like, it's clinically, it's like impossible that you have that, But they were convinced, and that the supervisor had to take this person way back and go, calm down. That's not what you're dealing with. You're okay. And we're able to get the person some help. But my point being, when you have a person who can help everyone synthesize that information, it's a powerful, powerful role to play, to help be the guide.
Absolutely.
Yeah, I kind of think that, and so many people, you know, are sucked in by the marketing of the world. Like, you remember, I don't know about you, but you see an ad and it says, it pops up on your phone, and every day you see the ad and it says, if you take this, you're going to lose weight or you're going
Yeah.
to feel better. This is and sometimes it's so tempting. You think, I mustn't know this, like I must have to read. And then you click on the link, and then pretty soon you just see this is just bullshit, or
Right.
garbage. And and I think that so many people in the fertility world are sucked in by that kind of thing. Like, they're watching this TikTok or this podcast or this YouTube, and they're following somebody with all the answers, and they don't have any answers. It's just a couple of questions.
I'm just going to say a lot of those things, sure, maybe it worked for one person, but it is not good for everybody. It's
Correct.
Yeah.
Correct. Yeah.
The comedian Andrew Schultz, he's on Netflix. He's got really interesting comedy. I just did a Netflix special on the journey that he and his wife had. It's a comedy special about the journey of them seeking out uh, fertility issues, and dealing with it, and the journey of them having their daughter and what they went through. And it's probably one of the most raw comedy specials I've ever seen, about this person going deep about this journey. And he finishes off sharing the pictures of their daughter. And he's like, one of the things that he said, he's like, he's like, as a young man, he was convinced that having babies was easy. And he was just like, he didn't realize how their own experience was so different. And his comedy goes into in depth about how he had to go really deep and look at that, because we think this, and everyone's taught, like you said, everyone on TV, this is easy, all this is easy, this is easy. It's like, I'm naturally thin build, and when I see someone online who's like, I'm going to teach you how to get ripped, that doesn't work for me. Like, I do that. I go to the gym and I don't come home looking like that, because we're all different.
I know.
Our bodies are different. The way we
Correct.
react to treatments is different, And so I feel like the personalization of this medicine as well is, we're helping people sit there and go like, how can we help you on your journey? Because it's not going to look like them. It's going to look different.
Correct.
Yeah.
And that's what, when we talk to patients, I say to them, one of the first things that when we talk to them is how can I help you? Like, you've done everything. And I encourage them, you've done everything right, because nothing's worse than having a practitioner sit down and say, "Oh, you've done it all wrong. Here you
I,
are. Let's start again." And I'll say, "We're just beginning our journey together. But I want to commend you. You've worked really hard at this and you're doing everything." And if they come to me and I give them instructions, okay, let's get you a red light. Let's get you a TENS unit. Let's start doing some castor oil packs, or whatever I happen to tell them to start doing at home. And then I check in with them 3 or 4 appointments later. "Hey, what are you doing?" And they go, "Nothing. I'm not doing any of that." I don't go, "Oh my God, you're just not trying." I go, "Okay, guess what? This is going to be fine. You're doing great." Because this is their journey, not mine.
That's
yeah,
Like,
a great point, Colleen, because meeting them where they are so important. And I have people and I say, if you're a huge data nerd like I am, then let's do BBTs and let's do this and let's graph it out. It's so much fun. But if they're not that person, and if they're, very overwhelmed, very stressed, and I know that will put them over the edge, I said, don't worry about it. It's good information. It's not, we don't absolutely have to have it. Let's do something else. Are you going to be stressed
correct.
out because you had a cup of coffee? Stop. It's not a big deal. If, you're still having a glass of wine, if you're not there yet, you're not there yet. It's okay. And that, I think, just telling them that that's okay and they need to calm down because they feel so helpless. And whatever we can do to empower them and make them feel like they're doing the right things for themselves is so important.
yeah, it's so true. I remember once two of my friends were having fertility issue challenges, and they tried for years, and they tried everything. They tried everything that they could think of. And finally, I actually found them someone that was going to be an egg donor and would be a surrogate for them. And they were so happy, so excited. And my friend went to check, everyone was going to get checked, and they were getting ready to start doing procedures. And then she was like, I need to go to the doctor. I'm not feeling so good today. She was vomiting, and she was pregnant. And the doctor was like, well, sometimes when you
There you
find
go.
your space, when you start pulling back, and what the doctor said, like, I don't have answers for this, but sometimes when you can find your own peace, things happen, and it's everyone's journey is different. Can you help me? But these stories are powerful for people, but can you share stories without identifying details of how acupuncture helped a patient on their fertility journey?
Well, I love treating, and I have a lot of patients who are advanced maternal age. So I had a lawyer come see me probably, well, 3 months ago, and she's 43 years old, and she'd been doing IUIs, and they've been trying to conceive for about 3 years. And she came in and saw me, and they were like, "We don't know anything about acupuncture. Tell us everything." Both partners came. I sat down. We went through their roadmap together and talked about, okay, this is going to be hard because you're not 22, you're not 15. I always tell them, being a teenager is the easiest way to conceive. Being 43, just your egg quality is poorer just based on age. So we talk about all those negatives first. We get that out of the way. And then I talk about all the positives and how acupuncture can change everything, that we can change their ovulation, we can improve it, we can improve their linings, we can improve their birth rates, we can give them hope, we can decrease their anxiety. So
Yeah.
I talk about all that with them. And I told them that, okay, and I told her, and I didn't even remember this, but I said, in 3 months, we'll take stock and see where we are and what's changed. But it'll take us 3 months to kind of get started. But we're going to be working every appointment until that 3 months. Like, don't think that we're not starting right now. We're starting, but in 3 months, we'll kind of get together, the three of us, and talk about what we need to change, add, or improve on this appointment. And at 3 months, she walked in, they came in together for their regrouping appointment, and they were pregnant. And she said, "You told me it would be 3 months." And I was thinking, oh my God, I didn't think I said that. Like I guess I said 3 months, but I wasn't thinking pregnancy in 3 months. But
Right.
yeah, they're 9 weeks pregnant now, and I see her twice a week because of that increased risk of miscarriage, right? So now we are on a different journey to keep everything in place. And but yeah, that first hurdle we overcame. We got a pregnancy at 43, like,
That's awesome.
so it's super exciting.